Okay. Hello, everybody. Oh, now hold on one second. I need to get this out of the way. Stop share and share again. There we go. Hello, everyone. Welcome. It's Ladies' Night, and I'm so glad you all are here with me. I'm so thrilled and so honored that you're joining me, that we can spend an hour together talking about our heart health and our brain health. It's just a true blessing to be together tonight. So I have a fun agenda planned for all of us, and I welcome everyone to the table, and I think we'll just go ahead and get started. So the items I want to cover kind of grandly are education, awareness, and action, which will lead to advocacy, because it's so important that we advocate for ourselves and advocate for those who we care about and we love, and we want to share this information with them. I have our latest book highlighted here in the corner because a lot of the information that I'm talking about is in this book, and I will reference it later. So my hope is today that you will leave with more resources and be able to share this information with others. Matter of fact, I actually have something I'll call Amy's rule of threes. And there's three things I'm going to ask of you tonight. The first one is simply jot down three things along the way that you learned and you were interested in or you thought were interesting, and just jot them down. You do not have to be an expert in any of these, but three things that kind of got your attention. And then I want you to share that knowledge with three other people throughout the week. Just tell three people three items that you learned tonight. And then let me know what you think. I want to do better always, and I would love to know what your three items were. And so there's an email link here called share@preventioncenter.health, SHARE, for those that are listening. And you can just send me your information. I'd love to know what little tidbits people found to be the most interesting. Okay. So here's some stats. 1 in 3 women will die of heart disease. 1 in 5 of us will suffer an ischemic stroke. And 2 out of 3 Alzheimer's patients are women, which is a pretty startling statistic. So I put together this Venn diagram. I wanted to kind of show you how cohesive these three different disease states are. We've got heart attack and stroke on your left, and we've got dementia and Alzheimer's on the right. Now, dementia is an umbrella term for a lot of different diseases that cause memory loss. Alzheimer's disease, Lewy bodies disease, cognitive decline, ischemic, microischemic disease of the brain called vascular dementia. So as I go through this today, I will reference dementia, but realize that's an umbrella term that includes Alzheimer's. And when you look at this Venn diagram and you appreciate the crossover of all the things we know that really can cause heart disease, like blood pressure, diabetes, chronic inflammation, periodontal health, depression, all of these things definitely we know, and I'm going to cover some of them that cause heart attacks and strokes, and equally have play in the world of protecting our memory or compromising our memory. So we're talking about three different things tonight: heart attacks, strokes, and dementia, and what we can do about them. So let's carry on here. Here's the problem. We actually function in a healthcare system that is focused more on sick care than healthcare. We go in when we're sick and we get treated when we're sick. The idea of going into just when we feel great doesn't really happen very much and isn't necessarily supported by a traditional insurance healthcare model. And that's a problem. It's a problem because when we all think about it. What do we want? It's a pretty humble goal. We want our health span to match our lifespan. I mean, that's not being overly dramatic. I want to live my life and I want to have my health, including my memory, along that journey. And the problem is pretty profound in that as we look at time, as we age as women, as we get older, our healthcare expenditure costs go up and our quality of life goes down. And there's this intersect. And in that intersect, it affects our quality of life dramatically. And matter of fact, there's a well-published over decade long age disparity between health and life. So part of my goal today is that you leave with the tools to understand how do we remove that pie and how do we allow our health span to match our lifespan, because that should be the goal that we all have and honestly that we all deserve. I mean, there's so many reasons why, but I wanted to throw this out at you because it was published last year and it got my attention. Fewer than 30% of participants in industry-sponsored early phase trials include women equally. Why is that? Well, back in 1977, the FDA placed a blanket ban on women of childbearing age to be included in early phase clinical trials. The ban was ultimately lifted in 1993, which is not that long ago, but the legacy of this exclusion remains. Medicine has long treated women as if we're just smaller men, yet women experience 2 times the rate of adverse drug reactions. So this is a deep-seated problem within the industry. So we must stand in unity, and education truly is the only way we're going to break through this, and we must support each other in that process. So that, I believe, is how it's going to get better. Education and awareness are the very first baby steps to make this change. There's a challenge there too, because women's awareness of heart disease is actually declining, which I hate to admit. But an online survey of US women over age 25, it was conducted between January 2009 for about 10 years until January 2019. The awareness of heart disease being our leading cause of death in women, in 2009, about 65% of women were aware, and in 2019, that awareness decreased to 44%. The challenge is the rate of awareness of the risk of cancer is going up. And that's incredibly important and incredibly valuable. But yet, it shouldn't be one or the other. The other of heart disease risk should not be going down, because ultimately, heart disease is more deadly than all forms of cancer combined. And annually, 1 out of 31 women die of breast cancer, whereas 1 in 3 women die of heart disease. Education is key, and it's well studied and well published that educated women should, and that's not a degree, that means women understand their risk, show the greatest awareness of heart disease risk, and that's, I think, incredibly hopeful. And we're different than men. We have different symptoms than men when we talk about heart attacks. 64% of women who die suddenly of a heart attack had no idea that they actually were harboring deadly heart disease. No idea. And at the time of a heart attack, women had a greater number of non-chest pain symptoms than men. And these included things that are very common, like nausea, heartburn, stomach pain, shortness of breath, anxiety. So then you sit and you see these and you think, well, yeah, yesterday I felt anxious. I felt short of breath. I was having some nausea. What I like to tell women is the following. If you feel differently than you ever did before, and it's significant, go in and get evaluated and don't second guess yourself, because we present differently from men. And so if you feel differently than you ever have before, consider the plausible reality that it could be your heart. And there's no better news than to be really run through the paces and be told you are okay. So don't ever feel bad about going into the emergency room, getting a full cardiac workup, and have them tell you you're okay. That's good news. Compared to men, women with diabetes have a 44% higher risk of heart attacks. And compared to men, women who smoke have a 25% higher risk of heart attacks. Did you know that women who experience intimate partner violence and domestic abuse have a 44% increased risk of a heart attack? And women who live alone report greater barriers to care, such as greater financial issues, isolation, and decreased access to care. So let's break through this. Let's break through these statistics with awareness and advocacy. So, have you often wondered, like, well, who's at risk? I don't have a cholesterol issue. My blood pressure seems great. Am I at risk for a heart attack or stroke or dementia down the line? Am I at risk now in my healthy enjoyment of life? Am I at risk for later in life? So, these I'll call red flags, which are disease states or situations that we deal with at the moment, and we don't really put together the fact that they're telling us a story about what we might be vulnerable to later in life. So let's talk about some specific red flags that are very telling during our lifespan, women during our lifespan. These include things like autoimmune diseases, migraine headaches, psychosocial health, pregnancy. Pregnancy is a beautiful opportunity to place our body under a tremendous stress situation and expose vulnerabilities that might lead to risk later in life. And then let's discuss menopause. And yes, let's discuss the latest data as it relates to hormone supplementation and is it safe from a cardiac standpoint or not. So let's jump through some of these red flags. And we all have them, by the way, so don't feel bad, but maybe jot a few down that you recognize that you might be at risk for. So the first one is fun. And if I didn't put this in there, people always ask me about this because we have it in our book. But there's truly something called Frank sign. And it was published initially by a gentleman, Dr. Frank, who recognized that people who had heart disease had this diagonal earlobe crease that appeared more often later in life. It doesn't have to be both ears, it could be one or the other. But people who have this Frank sign actually have a 78% increased risk of developing multi-vessel heart disease in their lifetime. Why? We have no idea. It's just a genetic expression that we can recognize. There's other things like male pattern baldness. There's something called xanthomas, but I thought I would share with you something easy. When you look in the mirror, you can look for these Frank sign. All right, so let's examine just a few of these red flags as we go through various stages of our lives. Migraines and vasomotor symptoms. So vasomotor symptoms are associated with perimenopause and menopause, and they include the things that drive us crazy and actually dramatically affect quality of life. It can be hot flashes, it can be vaginal dryness, it can be incontinence, it can be disruptive sleep, it can be emotional stress, it can be all kinds of symptoms that are related to hormonal fluctuations as we go through menopause and before that perimenopause. But women ages 18 to 30 with a history of migraine who later develop significant or persistent vasomotor symptoms with menopause show a threefold increased risk of stroke in their lifetime. And that's something to be aware of. Another one that's very common, 1 out of 10 women, by the way, experience a condition called polycystic ovarian syndrome. Women with PCOS is the acronym, are 3 times more likely to have heart disease than women who do not have this condition. And fun fact that a lot of people don't know, the brothers of women, the biological brothers of women who have PCOS, have equal metabolic risk, but just don't know it because they don't have ovaries that would provide the diagnosis. So that's an interesting fun fact. Polycystic ovarian syndrome affects 1 out of 10 women. Things that are commonly associated with it are infertility issues, acne, high testosterone levels, lower sex drive, body hair pattern changes, ovarian cysts, irregular period patterns. And it's a really overt syndrome that really has a multi-body impact. But at the end of the day, when you look at polycystic ovarian syndrome, even the latest guidelines from the American Heart Association say if you have a history of PCOS, if you have that history on your in your life, you need to get tested for arterial disease early. And we'll talk about some tests. Like they say, if you have a calcium score over 0, you need treatment. Pull statins off the shelf early if they have disease. Get a carotid intima media thickness test. Understand blood pressure fluctuations and lipids. The earlier we can intervene to protect your cardiovascular system, the better long-term outcomes that women are going to have. Let's talk about pregnancy, because pregnancy tells such an important story about our future cardiovascular health risk. Let's talk about a few common complications with pregnancy, like gestational diabetes, preeclampsia, high blood pressure during pregnancy, and postpartum depression. Gestational diabetes tells an important story. Matter of fact, think about it this way. When we are supporting the life development of another human being, our body is almost undergoing a glucose tolerance test all the time. And when we go through that pregnancy, sometimes the beta cells that make insulin in the pancreas show that fatigue, and we can see the increase in glucose levels during the pregnancy. And oftentimes after pregnancy, the sugar goes back down to normal, but it does not mean the risk of type 2 diabetes long-term goes away. And it doesn't mean the heart attack rates go away long-term either. Gestational diabetes shows a 2-fold risk of developing type 2 diabetes during a lifetime and a 68% likelihood of developing heart disease. Doesn't have to be this way. We just have to be aware and we have to do something about it. Preeclampsia during pregnancy, which is an emergency. If a woman is struggling and showing life-threatening symptoms of preeclampsia, the only treatment is birth of that child. Otherwise, you risk death of the mother and death of the baby. It's very, very serious. And when that emergent event is over and hopefully mother and baby are safe and healthy, the immediate symptoms of preeclampsia will fade. However, 4 to 5 years after that pregnancy, that mother is at a 2-fold increased risk of venous blood clots, like pulmonary embolisms and venous blood clots in the legs. 10 years after the pregnancy, that mother is at a 2-fold increased risk of heart attack and stroke. This is well beyond the time that women often think about their birth story and the fact that preeclampsia was a problem during their pregnancy. So be aware. High blood pressure during pregnancy. Women with high blood pressure during pregnancy have a 41% higher risk of a heart attack or stroke later in their lifetime. So be aware of these red flags. Another one that I want to focus on that I think is under-recognized, certainly in the world of heart attack and stroke prevention, and certainly in the world of traditional cardiology, is a very profound illness that is very rare and very common and often unrecognized and untreated, and it's postpartum depression. Women with postpartum depression have a 36% higher risk of developing cardiovascular disease compared to unaffected women. And they also have a 20% higher risk of heart disease compared to their siblings who didn't struggle with postpartum depression. So it goes beyond, um, um, the biological similarities of siblings, which I think is interesting to point out. Let's talk a bit about menopause. I love this quote by Dr. Christiane Northrup. Because you can take it many ways. Biology way would be, well, yeah, our bodies are changing, and we're going to let go of our own endogenous estrogen production, and you learn how to take care of our bodies after that. But even emotionally, there's a freedom to the sense of menopause is an opportunity to gracefully let go of what no longer serves you and welcome in new possibilities. And that can be on a psychosocial level, even recognizing how valuable your closest friendships are, and recognizing your own mental health, and finally getting mature enough in life to really put yourself first in a lot of situations. So I just thought this quote is multifocal, and I appreciate her saying those things because it's very true. Here's something I want you to know. The younger someone goes through menopause, whether it be surgical menopause or natural menopause. Surgical menopause would mean a hysterectomy with the removal of ovaries, or natural menopause, right? The younger someone goes through that situation, the higher risk they have later in life of developing heart disease. Particularly ages 40 to 44 is the highest rate. But on average, as we hit into menopause and postmenopausal time of our lives, which is, by the way, 48% of our lives, by the way, we show about a 2 to 6-fold greater incidence of heart disease than our pre-menopausal selves. So what about hormones? Well, a couple things I want to say about this. One, I want to tell you that I am not a hormone expert. I treat women for the prevention and treatment of arterial disease. And there are certain conditions that I deal with clinically that women that are a higher risk for thrombotic events, that despite their age, I might advise against exogenous hormone therapy. But in general, when basically data was evaluated from 40 US centers and collected from November of 1993 to September of 2012, evaluated basically a year and a half ago, they realized that it really is about timing. 27,000 plus postmenopausal women with those vasomotor symptoms I talked about earlier. These findings support guideline recommendations in general, but again, individualized is where it's important. Between the ages of 50 to 59, there appears to be no increased cardiovascular risk, and data inks into the idea that there can be benefit. Between the decade of our 60s to 69, we need to use caution, and we need to be thoughtful on, do we need the hormones for vasomotor symptoms, for all kinds of reasons, but just be very thoughtful and be very individualized in that recommendation. And then over age 70, it's really not recommended that hormone replacement therapy should be on the table in a generalization. So things are starting to change as far as our understanding of these recommendations, and I'm quite pleased about that, because after the Women's Health Initiative, which was such a poorly designed trial, everyone was afraid to even evaluate hormone replacement in women for decades. So I appreciate everybody's work in this arena to give us more guidance and more support to understand what we should do personally, and we as providers should do as well. I thought this was an interesting sort of illustration, and it's oversimplified, but I think it provides some explanation. If you think about estrogen, We make it ourselves, and then menopause means we don't make it ourselves anymore. So when women are in early menopause, hormone replacement therapy, up into about the age 60, and within 5 years of menopause, has been shown to be neuroprotective, meaning it improves our memory, our cerebral blood flow, and it balances cortisol. When we are in later menopause, more than 5 years when we stop having regular periods, and definitely from age 70 on, um, exogenous estrogen or hormone replacement therapy can be neurotoxic and affect cognitive disturbances, so including Alzheimer's disease. So the neuroprotective effects we see at a younger age don't innocently transpose over to its utility at a older age. And again, it's individual, and you need to have that discussion with your healthcare provider. Also, one other red flag I want to mention about women in our lifetime: we live longer than men in general. So it's very common that women become caregivers within a household, whether that's a caregiver of a disabled child long term, whether it's being a caregiver to our loved one, our partner, our spouse, whatever the case may be. Women tend to take on those roles naturally, and by default, we live longer than men for sure. And so it's just something we need to be aware of. And when women are caregivers, whether it's again caring for a child long term, um, a partner, a spouse, women show a higher risk of heart disease by 17% in the first 1 to 4 years of being that full-time caregiver. This happened to look at a partner with cancer, and a 36% increased risk of stroke over 5 years. And the reason I point that out is we need to watch out for our neighbors and our family, because by the time someone has been a caregiver for over 5 years of somebody they love, their appointments of their own healthcare needs often get in the shadows. So their dental recall visits, their own personal health evaluations, their sleep pattern, their diets, etc. And it's long after the time that people are offered meals of support and things like that. So be aware of your environment, be aware of what your neighbors and family are dealing with, and be there for one another. I just want to shout that out because I think it's just so important, and it's something we all should and could do. All right, so let's shift gears a little bit away from what I call red flags. So we can have a lot of red flags, and now let's figure out, what if I have some of those? What if I had preeclampsia during my pregnancy? What if I had high blood pressure during pregnancy? What if I had early menopause? What if I had migraines? What are we going to do about it? So the first thing we need to do is understand really what causes a heart attack or an ischemic stroke and microvascular disease of the brain. What causes it? Well, actually, it's something called plaque. A fancy name for it is called atherosclerosis. For the sake of today, we're going to call it plaque. And as you see in the illustration on the left, plaque is sneaky. It doesn't, if you think about a garden hose, it doesn't just present itself where the water flows. It actually builds up in the wall of that hose, similar to like a pipe rusting. It doesn't show itself until it does. And when it does, it's usually always a surprise, and it's never wanted, to be honest. So we can be walking around day to day, being healthy, enjoying life, and have plaque hiding in the wall of our arteries and have no clue that it's there until it misbehaves. So what causes plaque to misbehave? Anything acutely inflammatory or chronically inflammatory can cause that plaque, which is hidden safely in the artery wall, and I'll show you an illustration of this, can rupture through that artery wall. And as blood floats by, it says, don't you worry about that. I'm going to fix that for you right now. And the blood sends in red blood cells, platelets, all kinds of clotting factors, and we end up with a blood clot. And if that blood clot blocks the flow of blood of a big artery in our brain, it's called a stroke. If it blocks the flow of blood in an artery of our heart, we call it a heart attack. So let me show you what it looks like and why it's such a surprise. See, this plaque is active and the body's trying to oxidize cholesterol particles. They form foam cells. They cause a rupture in the body. As quick as a second, I'm going to fix that for you. And as you see, no different than a garden hose, if we have a blockage, everything downstream from that is not going to get oxygen. And if it happens in the heart and it blocks blood flow to the heart muscle is not going to survive. Or if that blood clot happens in the brain, we're going to call it a stroke, and we're left with stroke symptoms oftentimes. Now, cardiology and emergency medicine is amazing. So if we have the opportunity to get in soon enough, they can do amazing things to open up that artery. But if all we do is open up that one artery and let's say put a stent or, an angioplasty, open it up, we just put a Band-Aid on a 30,000 mile vessel rash because we have 30,000 miles of arteries in our body that feed nutrients to all of our organs, all of them. So what happens more often that we don't talk about, and we need to, is that most of our arteries, as you see kind of in this picture, are so tiny. They're no bigger than a human hair. They're the arteries in the eyes, they're in the kidneys, they're in our brain. They're throughout our body, and they have a vital purpose. And that is they bring oxygen and nutrients to every cell in our body. So oftentimes when we have plaque in the artery wall and don't know it, the disease is silent. So over time, we get these small little clots that affect small little capillaries, and it continues to go on until we exhibit symptoms. Okay. And what are those symptoms? In the brain, we're going to call it dementia, memory loss. In the eyes, we're going to call it blindness, macular degeneration. In the heart, we're going to call it chronic heart failure, where that heart muscle just can't pump effectively anymore. The kidneys, chronic kidney disease, right? And that leads to an end stage disease of dialysis. The extremities, over time, the little vessels that feed nutrients to our toes and our fingertips don't work as well, and we deal with something called peripheral arterial disease, which affects our lifespan and health span as well. Interesting fact about this, that we are also in a deficit as women. Men have an organ in the middle of their body that if it stops working due to microvascular disease, it's called erectile dysfunction. And the treatment for erectile dysfunction are medicines that cause vasodilation. And so men who go in with this symptom are picked up for vascular disease decades before we are, because our first symptom is dementia or kidney disease. So understanding our risk as early as possible gives us a lifetime to enjoy good health. And that's an important differentiation between men and women also on how quickly they're picked up for microvascular disease. These are all preventable. They absolutely are preventable. So, well, if plaque hides in the artery wall, can I find it before I have a blockage? Because a stress test will tell me if I have a blockage. That'll tell me, but I don't want to wait that long, right? Yes, there are a couple of tests that are safe and effective. Well, gosh, will my insurance cover them? Probably not. I mean, preventative testing isn't often covered by insurance, but you can ask for them. But you know what? Money is tight, and I probably can't afford such testing. Two of the tests that I'm going to tell you about are pretty reasonable. They're on average $50 to $300, depending on your location. And while that is still a lot of money, oftentimes if we know they're available, we can save up for them and get them done. And two of the most common and readily available is one called a carotid intima media thickness test, where we look with ultrasound, very safe, no exposure to radiation. And we look at, again, the wall of the artery to see if there's any hidden plaque. And that can be done at any age in our lifespan. We know what normal thickness is down to about age 5 to around age 85. So it also gives us a valuable age match comparison and looks for little spots of plaque. The other one that's also really available is called a coronary artery calcium scan, which has value if you happen to be over age 50, because the calcium on the plaque tends to develop later. So if you get a 0 score, no calcium, you could still have plaque. So any score above 0 is a big deal. So both of these tests have value. And the first one, the carotid intima media thickness test, we do every year on our patients because we want to know that the arteries are getting healthier. And this test allows us that opportunity to see that. So also it's important to check your inflammatory markers. We have a lot of them that we check if you're a patient. But two that you can easily ask for and are available through all labs, LabCorp, Quest, any of them, is one is called HSCRP, and it measures more systemic inflammation that can also affect arterial inflammation. And another one called LPPLA2, it stands for lipoprotein phospholipase A2, is more specific for inflammation of the arteries. And matter of fact, it's one of the only FDA approved tests, blood tests that we have for specific for stroke risk. So those two are really valuable. And I want you to ask for them and ask your medical provider to teach you what those mean. And if you don't know, you can read our book. You can get more information about them, but they're easy to get. They're very inexpensive. And I want all of us on this call to know what our HSCRP and LPPLA2 values are. So education number one, understand the statistics, be aware. Action. Let's take action. Let's find out if we have heart disease or vascular disease. Let's find out if we have inflammation. So the next question becomes, I'm going to spend the next about 15 minutes on this and then we're going to close up, is asking, well, okay, if I find plaque or if I have a red flag that puts me at increased risk for plaque, what really causes disease in my arteries? What are causal factors of arterial inflammation? And a better word for that is oxidative stress, by the way, where the body breaks down at a faster rate for which we're repairing it. And when there's a misbalance in that, it can develop the ability for our body to trap cholesterol in that artery wall. And all the things you see underneath this tree are things that cause oxidative stress that leads to plaque buildup in our arteries. I'm not going to cover them all tonight, but I'm going to cover a few that are often not talked about. When I talk about cholesterol, I'm not going to focus on LDL because here's a shocker. LDL by its little lonesome is not predictive of which one of us is going to have a heart attack or not. But I'm going to show you some values that are. Over 50% of women who have a heart attack have normal cholesterol values, specifically LDL values. I want you to take note of 3 important numbers that you will see on your labs, just a general lab. The first one is do a ratio. Take your total cholesterol and divide it by the good. That's called HDL. Think high, happy, divide it by the good. You want to keep that under 3.0. The ApoB is the most predictive lipid marker, and you might need to ask for it, but it's a very inexpensive test, and it represents a pooling of all the bad cholesterol. including the small dense guys, LDL, lipoprotein A, etc. And we want that to stay under 80. We have tighter goals if someone has higher risk, but in general, we want to keep it under 80. And then there's another factor that we've been measuring for 20 years, and it's a genetic lipid abnormality called lipoprotein A. 24% of us have it, and it's not been checked for routinely. We have been checking it routinely for, like I said, about 20 plus years. It is either a yes or a no, and you need to find out if you have it because it is independently causal of cardiovascular disease and cardiovascular events. So let's talk about some things we can do for our cholesterol. From a lifestyle standpoint, really diet should be genetically guided. And I'll just do a little call out for our lifestyle director, Monica Jacobson, who's a registered dietitian and nutritionalist. She has a class on eating for your genetics that really fine tunes it, because all of us are unique, wonderful individuals, and one diet for me might not be the best for the other. Exercise, we all need to move more, and we need to do resistance training. Weight management is more about taking care of the deep, dangerous belly fat and increasing our muscle strength than what an overall scale number is going to tell us. Medications, if needed, are life-saving. Statins are needed, and the best tool in our tool belt to stabilize plaque, and they help to treat ApoB. Supplements that are available that are extremely helpful for both ApoB, HDL, and lipoprotein A is a good old-fashioned supplement called vitamin B3 or niacin. We prescribe it for all patients with ApoB elevations or lipoprotein A elevations. By the way, statin therapy via the mechanism of something called autophagy, which is the body's ability to get rid of dead cells. We do it all the time, but statins promote autophagy with the brain's ability to get rid of amyloid beta and tau protein from the brain. And those are the telltale hallmark proteins causing Alzheimer's. So statins reduce Alzheimer's and dementia risk on average by around 36% when used correctly. Vitamin B3 or niacin protects against dementia and neurodegenerative diseases such as multiple sclerosis and Parkinson's disease. Let's talk about some root causes of oxidative stress and inflammation that are not talked about enough. One is autoimmune. Do you know that women have 78% or 78% more women than men are affected by autoimmune conditions? The most prominent being lupus, systemic lupus erythematosus, and Sjogren's disease, 9-1, and rheumatoid arthritis, 3-1, multiple sclerosis, 2-1, etc. We are far more vulnerable and are more commonly affected by autoimmune diseases, which is an incredibly systemic root cause that drives arterial inflammation and disease development. Rheumatoid arthritis, if you want to see some facts, increases the risk of a heart attack by 7-fold. Lupus more than triples our risk. Psoriasis, 50% increased risk of cardiovascular death. And all of these, the younger we are, the more severe the symptoms, the higher the risk. Sjogren's doubles the risk of heart attack. That includes symptoms such as dry eyes and dry mouth are some of the ways this is diagnosed. Crohn's disease increases risk of heart attack by 24%, and Hashimoto's thyroiditis increases the risk of heart attack by 50%. What do we do about it? One, we focus on an extremely anti-inflammatory diet. We focus on hydration. Exercise is key, and I want you to consider all forms: Zumba, Tai Chi, yoga, walking, biking, dancing, rebounder, working on our grip strength, standing goals, laughter, social engagement is key. Saunas are helpful for inflammation. Mindfulness is critically important in a daily routine. And adequate rest is probably one of the most important neglected drugs for autoimmune inflammation. Sleep is critical. We need to stay on it. And then if you are on a disease modulating drug for anti-rheumatic diseases, those also show value in decreasing cardiovascular risk and dementia. So if you are on what are called a DMARD for these autoimmune diseases, stay on them because they're also reducing your dementia and cardiovascular disease risk. A wonderful, wonderful tool that science can offer us. So that's great. Mental health. I want to talk about mental health because it's a very profound risk factor. So let's talk about stress for a minute. What is it? We all have it. We all are affected by different things that might increase our stress at different levels in different people. But the best unifying definition is the following. If you are in an environment for which you perceive a lack of control, the body produces inflammation and it creates oxidative stress that can lead to the trapping of cholesterol in the artery wall, believe it or not. And our only way to deal with it is to change our perception of our environment so we lower that signal, because sometimes we can't change the environment. If you can, great. But if you can't, we need to learn how to change our perception. When we look at things like anxiety increasing our risk by 50%, post-traumatic stress disorder is very important because one of the strongest symptoms for this are abnormal sleep patterns and nightmares. Depression is associated with a twofold increased risk of stroke. I thought this was interesting because Kaiser Permanente, they did an evaluation of hospitalization rates for acute heart attack or stroke before and 2 days after the 2016 presidential election. And by the way, did not matter, and they did not evaluate party affiliation. But what they found was profound. They found that 2 days after, and they just looked at 2016, they're looking at 2020 and 2024, and the rates are very similar. So this acute stress is a vulnerable situation for a lot of people, no matter what line of the aisle people are on. But heart attack rates increased by 67% and stroke rates went up 59%. 53% of these events occurred in women, and these women were between the ages of 18 and 54 years of age. Huge. Loneliness is something else I want to address. Increases memory loss and dementia. Participants with severe cumulative loneliness had a 42% higher rate of cognitive decline and 98% increased dementia risk. However, those who recovered from frequent loneliness were 33% or at 33% lower rates of dementia. So there's so much evidence that social isolation it affects our lifespan, our quality of life, increases our oxidative stress, increases dementia, heart attacks, and strokes. So again, try to fight that social isolation with those around you, those you care about, and take care. We need to take care of one another. We need to invite people over for dinner so they're not eating alone. And little simple things add up to have profound effect on heart attack and stroke rates and dementia risk. How do we reduce emotional stress? Things like yoga, meditation, avoiding loneliness. You can be lonely in a crowd of people, but you could be alone and not feel lonely. It's not a placement. Like if you are choosing to be alone and finding mindfulness and peace with that, that doesn't mean loneliness. Loneliness is a different feeling entirely, and that can happen in a room full of people. So just be aware of what true loneliness is. Optimism actually lowers our cardiovascular risk, which I like. Ask yourself often throughout the day and at least weekly, is my mind full? Like full? Or am I being mindful? Those are two totally different things. Tai Chi reduces our heart attack risk and can have some impact on stress. And women who actually are more self-compassionate, have less vascular disease. So I want you to keep that in mind. And please seek counseling. It's never been more needed than it is now. So counseling is one of the best ways to understand how we can change our perception to lower our oxidative stress levels. High blood pressure, this is pretty simple, but I want to set the facts straight. Normal blood pressure is under 120/80, period. If we don't protect our blood pressure and keep it under that level, now we are built to run from tigers and bears, so occasionally it would be up, but in general, like when we check our first morning blood pressure and even occasionally during the day, on average, it should be below this level if we want to protect the big arteries and the small ones. Do you know that if you have a high blood pressure or blood pressure greater than 120/80 on average at age 53, it's associated with dementia and memory loss by the age of 70. So we need to know what our numbers are. What do we do? Measure it. Measure your blood pressure in the morning, record it, report it to your provider if you see that it's either volatile or bouncing around. Have a blood pressure cuff in your home. Keep the goal at under 120/80. Report things that are different. Movement, laughter, mindfulness. Hibiscus tea lowers blood pressure. Beets, antioxidant foods, even regular dental checkups lower blood pressure. So do meds, and meds are critically important if they're necessary because meds such as ACE inhibitors like ramipril, lisinopril, and ARBs, they're called, like losartan, actually lower our dementia risk. So don't be afraid of medication if it's needed. Insulin resistance, that is one that we see all too common. 1 in 3 adults have prediabetes. 9 out of 10 have no clue they have it. So that's a problem. Do you know that insulin resistance is a syndrome? It has all kinds of stuff in it. It has lipid abnormalities, blood pressure issues, um, uh, weight fluctuations, can include fatty liver disease, all kinds of factors that are inflammatory to the body. And it takes about 20 years of us dealing with insulin resistance until finally the beta cells in the pancreas get so tired that they can't keep up. And we are told we are type 2 diabetic. So by the time you're told you're type 2 diabetic, your arteries have been hammered for 20 years. That's why 70% of people with heart disease have insulin resistance or prediabetes. 8 out of 10 Alzheimer's patients have insulin resistance. It's a syndrome that involves inflammation, oxidative stress. It damages all our organs and our arteries. Find out. Get a CGM. You can buy them over the counter. Those are those continuous glucose monitors. Just get the biofeedback so you know what your body is telling you. And, there's some other ways you can find out if your triglycerides divided by HDL, your good cholesterol, if that's over 3 to 3.5, for Caucasians, it's over 3.5. For African American and Black and brown skin people, over 3.0. That is actually diagnostic of insulin resistance. A fasting blood sugar, meaning you haven't eaten for 12 hours, should be under 100. At 3-month average, should be under 5.7. Get a glucose tolerance test, just like we did with pregnancy. If the 1 hour's over 125, you're cruising towards diabetes. If the 2 hours over 120, again, you're cruising towards diabetes. So get a CGM. They tell us, as I show you here, just such profound data. We can actually look at, you can see in this individual that there's the moment they start eating, they're getting these high spikes. And what we like is just a slow, steady movement throughout the day of our blood sugar, not these peaks and valleys that just wear our beta cells out. So get a CGM. It's so helpful. Lifestyle's critical to reduce diabetes. Matter of fact, it can reduce diabetes by 75%. That includes everything I have listed here and more. Keeping our waistline in check, movement, avoiding alcohol, avoiding all sodas, diet or regular. Get your genetics tested for ApoE and haptoglobin. get sleep and get treated for apnea, get tested for apnea. Certain supplements can reduce our risk, things like turmeric, berberine, cinnamon, chromium. Those all have data. Vitamin D3 has data to reduce our diabetes risk. And there's medicines out there that we use readily to prevent a progression towards diabetes, such as a drug that we've used for 20 years that reduces our risk by 72%. It's called pioglitazone. And the GLP-1 agents, when used appropriately, are incredibly good insulin sensitizers as well. Lastly, airway and sleep and oral health. And I'll be real brief on these, but I'm being brief for time. I'm not being brief because I don't want to minimize the importance. But more than half of women in menopause or menopause transition have sleep issues. Do you know that untreated sleep apnea doubles the risk of heart attacks, strokes, and cardiovascular death and Alzheimer's disease? Poor sleep quality and quantity increase our risk of obesity, type 2 diabetes, and blood pressure fluctuations. Get tested and get treated. It's probably one of the most important drugs out there is sleep. It's essential to protect our vascular risk. So we need to measure it. There's things like Oura rings, sleep number beds, watches. Talk to your healthcare team about your sleep. Also watch children who are mouth breathers. That should never happen. They're not getting adequate oxygen at night or during the day. If they're breathing, if they're eating and their mouths are open when they eat because they can't get air through their nose, they are at incredibly high risk for diabetes, obesity, and hypertension, even at a young age. So children need to be tested for apnea if they are mouth breathers and don't have good airflow through their nose. Don't be afraid to get tested. There are lots of ways to treat it other than CPAP, by the way. And also periodontal disease is associated with Alzheimer's disease. There's certain bacteria that can live in our mouth that are particularly causal of amyloid beta production, which again is that protein in the brain that causes Alzheimer's. A particular bacteria called PG or Porphyromonas gingivalis increases our risk of Alzheimer's and mortality. So you can get that bacteria tested from your dentist. Oral health is critical. It's a key piece in heart attack, stroke, and dementia reduction. Mouth breathing is not good. Hormone changes affect our gum health, gum inflammation throughout our lifespan. Optimal home care is critical. More frequent visits to your dental office. Go at least every 3 months and visit your hygienist. He or she is going to save your life. Definitely go there and ask to get your pathogens checked. It's easy and it's really important information. So as we summarize what we discussed today and I want to discuss some resources that we have for you moving forward. Kind of in summary, for education, we talked about heart disease, stroke, and memory loss, how they're all connected and how they're preventable. Awareness, be aware if you have some red flags. We all have them, and there's a lot more than I listed. And we talk about them in our book and other places, but we all have them. Be aware. And if you have them, do something about it. Find out if you have plaque, measure your inflammation, and find out your root causes. Everything under that tree, we need to find out if we're dealing with or not. And advocacy, you are important, you matter. Take care and advocate for one another as well. And then remember my rule of threes. Share 3 bits of information with 3 different people moving forward, and let me know your thoughts. I'd love to know what 3 items kind of stuck into your mind or little bits that you thought were unique and helpful. Email me at share, SHARE, at preventioncenter.health. Other resources we have, Monica Jacobson, our lifestyle leader at the office, has courses for you about navigating menopause, eating for your genetics. She has cooking classes as well. You can find these at our website at preventioncenter.health. And then I also want to tell you, get evaluated. Go if BaleDoneed method has developed an amazing telemedicine program where we can see people via telemed all over the country. Just go to BaleDoneed.com, and the phone number you can use is 509-994-9482. And there's a test on there. It's a free health risk test. Take it and see if maybe you have risk, and then get engaged with the telehealth program. The Prevention Center for Heart and Brain Health, that's where I reside, and I have a team of about 12 of us, amazing individuals. Um, uh, Two other providers besides myself, an entire nursing team, Monica, our lifestyle director, and we see you live and in person. If you come to see us in Spokane, we need to see you at least once a year to get all your testing done, which we do here in-house. But so there's no shortage of availability of getting checked out. You can do the telemed, which is extremely valuable and accessible. Go to BaleDoneed.com. And if you want to see me and my team specifically, go to preventioncenter.health. And then these 3 books, the first 2, Dr. Bale and myself, BaleDoneed Method, wrote the first 2. And then Monica Jacobson and Dr. Bria Seberg, who work with me here at the clinic, wrote The Balance Plate, which is a gluten-free eating cookbook and a very anti-inflammatory cookbook. So with that, I will bid adieu to everybody, and I want to truly thank all of you for being on this call. We will record this, and we will have it posted, and we'll send it out to all of you who have registered, and ask that you share with others if you found the information helpful. Thank you so much.